So the local government associations recently published a document about mentally healthy communities. So what does that mean? What is a community? A mentally healthy place is about the people in it, and it's about people understanding the importance of connecting with each other, about having the kind of facilities that people need to access and enabling them to access them easily. We all have different interests, we have different connections, and some of us are more reticent than others to approach people. So it's about people being aware of other people, enabling people to connect what's there, and having the right things there for people. So not just the essentials, the shop and the bank, but the green spaces, the library, and the other facilities where you can meet people, and you can meet people in a safe place, even if you're a mother of young children or an elderly person. So I think the idea of a health in all policies approach is just to make policymakers think about the health implications of the policies that they put in place. So if you think about housing policy, for example, or education policy, and how you devise the curriculum, and is there space to talk about, does the personal and social education get cut out of the curriculum, those sorts of things. Now, in terms of mental health, I think when we think about health in all policies, there's probably a tendency to think about physical health. And so we will have to go the extra mile to make sure that when we're thinking about those policies, that mental health is part of it too. And I suppose if you think about housing, it's a good example, isn't it? Because, your physical health can be impacted by a damp situation or cold or cramped conditions, but actually your mental health can be affected by living in a tall tower block where you don't know your neighbours, or in an isolated community without access to the right facilities. So it's about thinking mental health as well as about thinking health in all policies. So what impressed me about this event is there's a very diverse range of people participating and joining in. So I was here for the afternoon, and I attended the session about supported housing for people with mental health, which was led by a voluntary sector organisation. I ended up chatting to an architect in the audience. So it's not a group of medical mental health practitioners, it's the whole range of people that are needed and necessary to improve mental health, particularly in terms of prevention and addressing recovery. So I think it's the diversity of the attendance and also the diversity of the subject matters. And even on the panel I was on, I heard about things I knew very little about, and despite my background, and I now know more about them, and I go away better equipped, as well as hopefully the attendees of the conference. I think it was great to hear, I really enjoyed the session. I enjoyed learning about the perinatal mental health and some of the statistics that I haven't seen before about the cost of not doing it right, and how little, relatively speaking, it would cost to do it better, and that focus on parents. And I suppose what that shows is that, this is all of this is about how you treat people and invest in people and believe in people. And you shouldn't only invest in parents if they've got a problem. You should look and think actually the role of a parent's quite hard, and we should support people to do it. So I think that was the biggest bit of learning for me out of today. But I was very enthusiastic also to see the amount of thought going into developing step-down accommodation and to thinking about the ongoing steps for people in terms of where they live.
Brilliant.